Welcome to The Pursuit of Health, the podcast on health policy for a free and modern society. Well, welcome everyone to another episode of The Pursuit of Health. I'm your host, Rainer Schur, and joining me on the show today is Terry Wilcox. Welcome to the show, Terry.
Thank you for having me. I really appreciate it. It's great to be here.
So we're having you on today, Terry, on behalf of an organization called Fund the Patient, which is an organization that argues that we should spend more of our healthcare dollars on patients instead of systems and insurers. But before we get into all that, you also have a longer history in patient advocacy. And one thing that I think would be valuable for our audience to know is not only how you got into patient advocacy, but how you see the role of patient advocacy and sharing the stories of patients in the larger effort for healthcare reform.
Well, I think that's sort of evolved over the years. At this point, I've been in patient advocacy in one form or another for almost 2 decades, or I think, I'm coming up on 2 decades. And it started out as a storyteller. I lived in Los Angeles. I was a storyteller. I worked as a talent executive for award shows. I have a very interesting background prior to this, but one of the things that always drove me was storytelling. And I had the opportunity to be a producer on a series. It was a digital series called Understanding Cancer, and I went all over, the southern states, several southern states, and just talked to cancer patients who were going through treatment. And that started to you know, bring up a real desire to tell these stories. They were interesting, they were real, they were in parts of the country I'd never been in, with people who were struggling, and parts of the country I had been in. Arkansas, I've been in quite a bit. But all of those things said, that drove me. And then I met my mentor. I worked for her as a creative director for many years and still continue to tell stories, but I also learned a lot more about policy in that space. I really got into the policy piece. And then when she passed away, my husband and I founded Patients Rising when we moved to DC because I wanted to continue that. Now, as far as your question about the role of the patient advocate and what it has actually evolved for me. And it's even evolved very quickly over the past several years because media has changed and people's access to each other and the world. And everybody is one, post away from being an influencer of some kind somewhere. I mean, literally everyone. And so I think the patient advocate now, in some ways, is more savvy. Especially the ones who do it all the time. And so sometimes I find it complicated to get the real authenticity to it, especially living in DC, because DC is, I used to, you think Los Angeles is plastic. I mean, no kidding. Here we are, we're in the center of power, but there's a lot of manipulation here too. This is its own form of theater. I say all the time, I'm like, yeah, I live in a theatrical landscape. It's called DC. It's also reality in a weird way. But, patient advocacy is important. And one of the things that we do at Patients Rising, which is the organization I co-founded with my husband in 2015, is we train advocates. But it's not just to train advocates for talking points. Yeah, there's always talking points. There's always training them on the issue. Of course, you have to do that. But it's training them and also finding a strategy. Advocacy is about strategy. I tell everybody, I'm like, yeah, there's a million stories out there, and there are. I hate to tell everyone. Everybody's got a sob story. Everybody's got a story. You can go into, I can go stand on the street corner and find 3 or 4 stories that'll probably make you cry, by the end of the day if I wanted to do that. But those stories are only effective with the district they're living in.
Absolutely.
People say in advocacy or in, the world of medicine, you've got to have the right treatment for the right patient at the right time. That's a very common sort of advocacy phrase, so to speak. But you also have to have the right story in front of the right legislator at the right time. They're the ones that are calling the shots, in a way, not technically. But if you're wanting to change something or alter something or move something in a direction, that's what you need. You don't need just a bunch of random. Yes, stories are great. I am not, but my advocates will hear this and they'll be like, she doesn't think they are important, but they're only as important as the moment you're telling them and what you're trying to move.
Right, because
Yeah.
at the end of the day, it's a particular audience, whether it's a senator or a representative or a other kind of politician at the state or local level that has some kind of decision to make, and they're also kind of taking the temperature of which way the wind is blowing. And stories are powerful, and stories can make clear to them that there really is something here, right? It's not just these talking points. The story, if it's well placed with the talking points and the situation, can help leverage one way or the other.
Absolutely. And there's some offices you literally can't get in if you don't have someone in their district, their
Right.
state. That's the reality. And sometimes those people are really powerful
Hmm.
and you got to talk to them to even get a bill off a desk to get it heard or to give it a hearing or to do any of these things. And so all of that is incredibly, there is a logistical piece, a strategy piece, and that's what we try to fulfill and how we try to think. And we've evolved over that, even in the last year. Very technical. I think there's a place, the large organizations that have been around for some of them 100 years, 50 years, 40 years, they can have a big fly-in and everybody can go in with a piece of paper and they can have their 3 bills, and Patients Rising did that for a little while, but we're not as effective as that at that. We don't have the historical precedent for that. But what we can be effective at is this other thing that I'm talking about, which is, almost like advocacy SWAT teams. Because you do need that. You need the powerful stories in the right places. And that just telling stories, yes, it has a place, but that's not going to move legislation. And legislation is what we need for what we're talking about today. Presidents, tweeting and truthing out, and members of Congress are wanting to move. All of that is a strategy, and all of that takes storytelling and support from the people, as they say, because they need the people, because the people who are the ones who are putting them in office, and especially in the House. I mean, they have to run every 2 years.
So I was going to turn to funding the patient, but could you just tell me just a little bit what does that kind of strategy look like? I hope this doesn't involve selling any kind of secrets of the trade of how to do that.
No, not at all. And I don't think it's a secret. I always tell everybody, I'm like, the greatest gift in my life would be for things to be solved in a way that I'm out of a job
Hmm.
for this
Absolutely.
and I have to go
Yeah,
talk about something else. I mean,
likewise.
literally all the time. I'm like, yeah, this is so I don't have any trade secret, but how we've started to think about things. Every website has a story button on it, and ours does too. Share your story, tell your story. But if you go into our community and you look at some of the things, we're developing our patient senate, we're starting to tell every story and do everything, even if we're telling a bankruptcy story from a bankruptcy file that we're not revealing who's on it, obviously, because
Hmm.
we're not that kind of people, but we're looking at it and we're telling the story historically of that file. We're talking about what district it's in,
Hmm.
exactly what district it's in, because the district, thinking about things from the district level across the board can really, I believe, is the sort of the thing we need to move to move the needle forward. And to also think about ways, and we're doing this in our community because we train advocates. We have an advocacy masterclass, which is now called the LEAD program. It's, to learn to lead in advocacy, is training them to not only advocate for themselves, but to advocate for others. And that takes time. People think
Hmm.
it just takes, oh, you're going to come to DC and you're going to give me a bill list of 3 bills and I'm going to have a great time and see. Yes, there is that. But is that person really an effective advocate on the other side of that? I
Hmm.
would argue not yet. It takes a lot to actually really learn, because even when we do teams for advocacy, it's like, all right, we're going into this office. Who's the best person to talk here? Who's more right leaning? Who's more left leaning? We try not to talk about political parties, though you can tell who people vote for by what they say sometimes, obviously, in certain things. But that's irrelevant because I always say healthcare is one of the most purple things you can advocate for. And you have to be incredibly savvy about that. You have to be able to talk to anyone. You have to be
Mhm.
able to talk to people about anything and in ways
Yeah.
that you might not agree with them on literally anything. But perhaps this, healthcare transparency thing you're talking about, or PBM stuff, or, patent stuff. I'll use the other side. Whatever the thing is, you may not agree. You may not agree with them on anything else, but that lane where you're trying to solve this healthcare issue is the lane you need to get in and drive. And that's what that's how we try to work. That's what we think our secret sauce is, so to speak, and how we see the future of advocacy, because that's how things will change. It takes patient voices in districts, but a lot of this stuff, I got to be honest, and you know this too, it's too wonky to
Mm,
just give people a sheet
yeah.
and hope for the best. It especially right now, it's some of the wonkiest stuff I've ever advocated
Mhm.
on. And so, you look at the wonk factor and you're just like, wow, we've got a lot to do here, guys, for the advocates. And then they decide whether it's a thing that really resonates with them or not. And that's what you're doing. You're constantly trying to find, like, who does this really speak to? It's not about, it and being authentic, because we are in a world where authenticity wins.
Absolutely. And I definitely think that de-wonkification is something that we need in health policy. Not that we don't need people who are wonky who can work on the details, but I think
Absolutely.
a lot of those details often come after the kind of bigger discussions. But wonkiness can't actually replace that.
No, absolutely. I mean, because otherwise you're just in a bubble. Here in DC, it's one of the worst.
Hmm.
You can just sit there and read op-eds written by your friends all day long and pass them around. It's like there's nothing funnier to me than that, actually.
Right.
But it's part of the show.
Right. The theater.
That's the part of the theater.
Right.
Who cares if 15 people read it, or 50 people, or even 500 people? It's got a place. It has a goal. It has an objective that it's meeting. And it may just have been written for one person. You know what I mean? Literally.
Right.
And so that's the interesting factor in all this. But when push comes to shove, you've got to be talking to the people who are sitting around their kitchen table trying to figure out how to pay a bill. And that's the tough thing to do.
Yeah.
They don't care about this wonky stuff in
That's the
DC.
real world.
That's the real world. And those are the people that you need to move your people that you're trying to transform healthcare with in
Yeah.
DC.
That's where the actual leverage is.
That's where the leverage is.
I'm glad we took this little detour because I do think it's going to help our audience appreciate what you're trying to do with fund to patient because I assume like this kind of strategic perspective is something that you incorporate there as well. So let's get into that. What exactly is fund to patient? What are you guys trying to do to change healthcare?
One of the major things that we're trying to do to change healthcare is, I mean, it's in the title. And you and I both can go round and round about what funding patients over systems actually means, because it is wonky in and of itself, if
Hmm.
we're really honest.
Yeah.
It sounds good, and patients are receptive to that because they are tired of not being funded themselves. I mean, I even wrote I have a new Substack called State of the Patient,
Mm.
and I wrote even yesterday, about my own experience in this arena, using my HSA, using that factor to be funded, using something that we're talking about here. I I think used to HSAs were all for rich people.
Mm.
That was a talking point that actually worked, because in some ways maybe it was actually kind
It's a
of true.
tax saving vehicle.
It's a tax saving vehicle. But I would say over the past decade, the amount of transferring of out of pocket costs to the actual people sitting around their kitchen table trying to pay bills is so intense that almost everybody has a high deductible plan. Almost everybody has some kind of HSA attached to their plan now, or FSA or something, because the out of pocket costs are crazy. I mean, we had that. We had a thing. I had to go get my son a hearing aid for $3,000, right? It was $3,000 hearing aid. I had to use we used the health savings account because we'd put a little bit of money in it. But as I wrote about it, I said, if we hadn't had that, that $3,000 could have gone on a credit card that was 29.99% interest, depending on your credit rating or what your situation was. I've seen them higher than that even now.
Hmm.
But, that's the reality. And so funding the patient to people sounds good. I think it's a lot. I think there's a lot of factors involved in that as far as how you implement that. As far as what the poll said that that Fund the Patient ran with public strategies, all of that resonates
Hmm.
because patients are tired.
Hmm.
They feel used and abused by the entire system. They really do, especially those that use their health care every month, every day. The goal of Fund the Patient is to be part of the movement that puts patients back in charge of their healthcare, which is one of Patients Rising's main tenets, is giving people agency and choice. Because right now, many of them feel locked into a system that doesn't give them that.
Hmm.
And that is, I think, the secret sauce of Fund the Patient is yes, let's fund the patient, not the system. Let's give patients control. Now, the reality between you and me, there's a lot of education that has to go in that. And I think that's the number one thing with this. I don't think you can just open up the spigots and be like, hey, everybody is going to get money and everybody's going to go negotiate for themselves. It's going to take, as I say with everything,
Hmm.
it healthcare is wonky and it takes a lot of education. And honestly, between you and me and everyone else who is listening to this, people don't really think about it until it comes up and bites them,
Yeah.
comes up and destroys their life in some way,
Yeah.
or wrecks their life, or gives them pause to have to navigate something that irritates them beyond, like I had to do with this hearing aid
Hmm.
and other things. It gives them there's an inciting event.
Hmm.
There's an inciting event that brings on your healthcare education knowledge. And you're not going to get that out of people
Right.
just on the natural, just because you send them $5,000 or
Right.
$7,500, or it takes this to me has to go hand in hand with education, or we will fail.
Right.
That's my belief.
Yeah.
I believe in the mission, the message, the moment. I think it's time. I think America's ready.
Hmm.
I also think it needs to have a huge education campaign
Yeah.
for how it works.
I definitely agree with that part, but just to play devil's advocate just a little bit. So you mentioned this poll where Americans express a lot of frustration with the
Mhm.
healthcare system, and you're saying that, well, what that points to is that what patients really want is for them to be funded, right? But let's say that I'm like I don't know, Bernie bro, I want Medicare for all, and I could say like, hey, if we have Medicare for all, we can get rid of all these middlemen and all these other things. Um, how would you respond to that kind of critique that, well, we can take those same frustrations and just point them towards a completely different alternative?
What I would say to that is there's trade-offs for everything,
Hmm.
right? And I do think this is where the education piece comes in. A lot of people
Absolutely.
thought, "Oh, this is a great idea." A lot of people thought Obamacare was a great idea because it was going to, and in many instances it did get rid of the pre-existing condition clause, right? It got rid of that in the sense that you can get health insurance at any time. There's ways that you can couch everything to make it sound good, but there's an education piece to that was totally catastrophic.
Hmm.
You know, it was making that sound good was great, but what has it done to prices? What has it done to the cost of healthcare in the past decade? I mean, there is a direct correlation between the passing of that bill and where we are today.
Hmm.
Whether you want to admit it or not, whatever side of the aisle you're on, there is, and things need to be adjusted. Bernie says, yeah, let's adjust them. Let's have Medicare for all.
Yeah.
And we're saying, yeah, let's not adjust them. Let's open up the markets and give people some money and let patients negotiate.
Yeah.
I mean, I think one of the biggest catastrophic mistakes we've made as a country in general is attaching your healthcare to your employer. One of the worst, it is just number one. My dad, he passed away in 2020, but he lived with type 1 diabetes my entire childhood, and he was a CFO of a hospital system. He was in healthcare my whole life. That's where I get a lot of my some of my inside baseball and sarcastic knowledge at times. But my dad, never, it was number one thing was to have health insurance and to have a job. My dad never didn't have a job. He knew what that meant. Nobody was going to cover him for anything because of his type 1 diabetes. So when you look at people like my dad, and I think about that to this day, now he didn't need it when Obamacare passed because he had a job, right? But I did think about that because I thought all the people who've stayed stuck in a job, maybe they did or didn't want. Now that wasn't my dad's case. He really loved his work, but that is the case for many people. It's like, oh, my kid's got a rare disease or this, I can't, I'm stuck here. And I think part of Fund the Patient is starting to turn that on its head.
Right.
Like, let's have employers still contribute their fair share, but let's not do it in the way that they run the plan.
Right.
Let's do it in a way that they contribute something. There's all kinds of mechanisms now for that. But let's not do it in a way that's overbearing, that gives all the conglomerates the control.
I think you're right that what we need is an education campaign. What do you think that kind of education campaign looks like? What's its nature? Is it just informing people of the policy changes, or is it also trying to address certain kinds of cultural norms around the idea of shopping for healthcare? It's if people aren't used to this idea of shopping for healthcare, then is that also part of how you envision the educational campaign?
Yeah, I think all of that applies. I mean, I think that no, it is not just a public service announcements that we do in airports or things like that. I mean, I suppose that can have some factor to take you somewhere, but the general nature, in my opinion, is actually, healthcare is local, and the training for healthcare. You trust healthcare news from people that you know. This is another reason district by district advocacy is so important, because people in districts tend to know each other, or they live close. They can see each other face to face. They can have roundtable discussions on things. They can advocate for things together. But, when you talk about, yes, it's true. 80% of Americans believe their healthcare costs are a large part of the affordability crisis. Absolutely. That is true. But how do you get that 80% of Americans to be like, part of my affordability crisis, I'm going to now get some money from the government and I need to go shopping. Well, what am I shopping for exactly?
Yeah.
And how do I do that? And how does that break down? Because then you also have the system that's already in place that you're going to have to, butt up against. Yes, it is true that you should never pay the first bill, according to Marshall Allen, may he rest in peace, for your hospital bill, because you can call and negotiate down. But most people don't know that. So people don't have insurance or don't have any kind of negotiator on their behalf. I say one of the main times that you want your insurance company is when you walk into a hospital, because they have at least negotiated something that's far below whatever's on that charge master. Right? It's far below that. And so how can we, how do we translate that so people understand, well, okay, so if I'm going in for a surgery, I can just call and negotiate. Like I can negotiate a price. I mean, they love to, there are independent surgery centers. There are all of these things popping up, but there's also certificate of need laws that we haven't knocked it down, right? So certificate of need laws are a real problem, because you can negotiate all day long, but if there's no one to negotiate with, what are you doing?
Right.
So that is my point is, among this, these are amazing stats. And I think America's ready for a change, because what we've got right now is not working. You have people not getting the health care they need, skipping doses of medication, not going to the doctor. And some of it is just the human nature of us humans. I say this to my husband all the time. I'm not going to disclose the things that he has not done at over 50,
Hmm.
but it's like, dude, go do that.
Hmm.
You know, that's what you're supposed to do now. You got to get checked. Catastrophe has to happen for some people to even go to the doctor.
Right.
They're not
That's the
just going
way.
to go on the natural.
Yeah.
I'm like, you can give them all kinds of preventative care all day long, but if they're not just going to go on the natural, even though it's covered,
Hmm.
what
What's it going to take?
what's it going to take to get them to shop?
Right.
Okay. I mean, these are real substantive questions that we have to ask,
Hmm.
and that we have to figure out. I I love Fund the Patient, and I believe everything behind it. And I do think we're ready. But I think we have to be really realistic about is HHS ready?
Hmm.
Are towns and cities ready?
Hmm.
Are hospitals ready? This is one time we all have to come together and work on behalf of the people we're serving,
Hmm.
which is the American people who are paying for all this anyway.
Hmm.
And so how do we do that? How do we put down the swords and walk, and figure it out? Because it can't just all, there is always going to be government funded. There's, government funded programs. People always say, oh, America doesn't, socialize. I'm like, we are more than 50%
They're
socialized in this country.
they're here to stay for a long time. We like
Yeah.
energy, right? So like we have to
We
like work with them. Then
we have to work within the socialized piece of what we have
absolutely,
with the non-socialized piece of what we have,
absolutely, yeah.
of the free market piece. And how does all that work together for the betterment? Because when you're talking about this piece over here, for our most vulnerable patients and citizens, they're, that negotiating and stuff is done over there. But how do we lower the costs over here, right? In the free market arm, how do we lower the costs over here so that we can actually take care of people over here? See, there's a lot falling through the cracks, and I can get into all of that
Mhm.
around Medicaid, Medicare, Medicare Advantage. I mean, there's a million tangents I could go on. I'm
Mhm.
not going to, but there's a lot not happening over here, and a lot of people falling through the cracks and not getting the care they need
Right.
when they need it. And then we have this bloated, ridiculous thing going on over here where families can't afford, they have to decide between whether they're going to buy milk and eggs and bread
Mhm.
or whether they're going to go pick up their prescription. Where are we going to meet in the middle on that?
So when it comes to getting people to get used to the idea of shopping for healthcare, let's say we achieve that somehow, like just flicking a switch. But what about the other part of that transaction, right? Because having people shop for healthcare also means having people sell it, right? And that's where I'm often worried that things like HSAs and like price transparency laws, if the sellers of healthcare aren't used to selling healthcare like it actually is like on a market, right? Like where like a price actually means something and isn't just like something arbitrary. What would it take to get them used to that idea? Because like I see it in all sorts of ways where, for example, so many more primary care doctors could go into DPC, but
Mm-hmm.
they don't, right? Because they're used to working within the insurance-based system. Because I find the idea of being their own businessman scary, right? And which is not to say that it's not scary, but it's how do we m make it more normal for doctors and other providers to be comfortable with the idea of selling healthcare on a market such that people can shop for it?
Well, I think one of them is drive them into insanity with the amount of paperwork you have them doing.
Right,
It's
that's already
already
working.
happened. That's already working fantastically well. As a matter of fact, a few years ago, I met a doctor. Her specialty was Parkinson's disease. And she started a direct primary care practice for Parkinson's disease.
Hmm.
She said it was the scariest thing I ever did because I didn't know if the patients were going to be there. In the first year, I made a little bit less, charged $100 a month for my services, but I did whatever they needed. Every appointment. That $1,200 a year covered everything with me. And other things that she could do in her office, she just covered in that money. Second year, I broke even with what I usually did. And now I have a waiting list.
Hmm.
Third year, I have a waiting list. And that's because people are tired of
Hmm.
waiting. I mean, I have the audiologist for my son that I have because this was my experience with the doctor who I love. But the doctor's in a system and they have an audiologist that literally works, I don't know, 4 days a month. So he was like, I need you to get your hearing test before the next time you come in. It'd be great if you could do it on the same day so you and James don't have to come twice.
Hmm.
That was not possible.
Hmm.
That audiologist was booked out for like 8 months.
Yep.
It wasn't that bad, but it might as well have been to me what I was trying to accomplish. And I went online and I found an audiologist in Reston, Virginia, and I called them up and I had James in for a hearing test the next day at 2 o'clock. Okay. So there are people out there like this great audiologist that I love who are easy to get into. They still take insurance. She bills stuff. I get little
Hmm.
bills or whatever. Now it didn't cover the hearing aid, but whatever. I still, they still try to work within the system. Many of them, when they can. I mean, even direct primary care doctors, some on a base level, it depends on the direct primary care.
Hmm.
Not all of them are like no insurance. Some of them have, levels of insurance
Hmm.
that they'll engage with. Many are no insurance because they were just tired of the system, but some are willing to do some things.
There's plenty of push factors, it seems, for providers who'd be selling the healthcare that people could shop for to do things differently. But I think one of the pull factors that also needs to occur is basically giving them like a moral sanction. Like there was a piece in the New England Journal of Medicine that criticized direct primary care for abandoning patients, right? And abandoning the system. It's like, well, your panel size is too small. We have a shortage of primary care doctors. You're being selfish for wanting to go into direct primary care.
Well, it's the system's fault, quite
Mm.
frankly. I mean, they haven't valued general, practitioner doctors. They haven't valued them for quite some time. Pediatricians, them either. They've been kicked to the curb financially in every other way.
Hmm.
They're not, they're the and quite frankly, if you talk to any direct primary care doctor, they have a waiting list.
Mm.
So they're fulfilling a need somewhere.
Absolutely.
The direct primary care doctor I had like, serviced, I don't know, 600 people and 500 people on their roster, right? That one doctor, but they did it because most of us aren't sick all the time.
Mhm.
You learn the cadence of what you can do with who you can let it, with what you're going to be able to accomplish. And so I blame that on the system,
Yep.
payment models, and the ways that they've forced this.
Mhm.
The system setup has forced this, whether it was Obama. Now, many direct primary care doctors will flat out tell you it was Obamacare
Mm.
and
Yeah.
all the paperwork and all the nonsense that came with that for them, that they were just like, I'm out.
Yeah.
I'm out. This is not worth it. Whatever this is, it's not worth it. But regardless of that, we're going to have a shortage.
Mhm. I mean, what I think is particularly shameful of that article is to present this kind of false alternative where doctors should either suffer
Right.
uh, and in a system where their patients suffer as well, whereas that's just not the case. Like if you look at both doctors and patients in direct primary care, they love it, right?
I
And
love it.
in
Yeah.
and if anything, showing that there's a way to pursue fulfilling work that is also financially makes sense, that's gonna attract more people to primary care and actually stop the bleeding of the shortage.
Yeah. I think that I call it the Doc Baker phenomenon. It was the town doctor
Hmm.
in Little House on the Prairie. I think we need more town doctors. I think we need that model back. And I'm not a person who lives in the past, who's like, let's go back to the 50s and let's do it this way. And No, but literally, people need that source of trust and knowledge. And I think the way we've grown as a society, we're all in kind of cocoons.
Hmm.
Like I lament about this all the time because when I was a kid, I knew every neighbor I had. We played on the street, we did all these things, and now I don't.
Hmm.
My kids don't. We know a couple neighbors, they walk, we know their dogs, like, but it's nothing like that. We sort of lost that community feel to where we live,
Hmm.
and I'm sensing a resurgence of that in the things that people want to be out and doing together. People are open more now to experiences and getting together, and it just seems to be a growing need, and especially as more people move out into the world, into not into the world, but into the world of America. The other, the parts where people never wanted, the flyover parts,
Right.
where people wanted to stay away from. I i, I think we're going to see more of that, and I also think that that's where we need doctors. It's like the people who want to go out and all of a sudden buy an olive tree farm and sell olive oil. I mean, it's like, and they have a beautiful life where they sell olive oil, right? Direct primary care doctors can think that too, and direct Parkinson's disease care doctors, direct immunology care doctors. Because patients at the end of the day, if they feel seen and valued with someone they trust, whether it's through their HSA or whatever else they want to do, they'll find, especially the patients who are the most vulnerable, they'll find the $100 a month or the $150 a
Hmm.
month. We find stuff for our cell plans I never thought people would dig in and find. What
Hmm.
what we pay for a phone now is insane, but we do it. So, what you value, especially over here on the free market side. I'm not talking about the entrenched side over here of the vulnerable and the people who
Hmm.
really need our
Right.
help. And we need to set that system up in a way so that they're not stranded. Because right now this system's choking that one and vice versa.
Absolutely.
We're not set up. And so how do we fix that? And part of that is, is giving people agency.
Right.
Exactly what the Fund the Patient poll said
Yeah.
in all of those things, figuring out how to thread that needle.
That there's a different way that if we're really gonna help people out, it's about trying to separate the kind of public and private sector in a way that they don't choke each other out and gives patients real choice.
And I also think in some ways that you're going to get the greater buy-in on direct primary care when you talk about it from the standpoint of managing chronic disease.
Mhm.
This is my belief, because if direct primary care to people who have insurance that covers their annual visit and all of that, their annual checkup and their blood panel or whatever, the things that you get every year, to then say, oh, yeah, it's going to be $250 a month for you and your family to have direct primary care. I guess if you give them the money to do that, that's fine. What then is the insurance product that they're buying? Because they still need that.
Hmm.
Even the direct primary care doctor will tell you
Yeah.
still need that.
Yeah.
Because as I said, you've got to have somebody negotiating with that charge
Hmm.
master. And so that's the piece that'll be interesting and that we have to figure out, because that is why so many people, and this is one of the interesting stats, 86% of voters favor increased access to association health plans. Everybody would love to go to Costco,
Hmm.
quite frankly, where they get their eye care or whatever else they get, and get a sign up for health insurance that's either catastrophic or something that covers like basic stuff or whatever level they can get, and just deal with it. Because also the other thing that's changing in the economy is more people are working for themselves.
Mm.
And that's the truth. And there's going to be more layoffs as AI increases. And I say that no matter who's president, no matter what's going on, it's going to happen. It's coming for all, it's coming for everyone in one way or another. And people are going to have to adjust and pivot with how they operate in the world. And and that's one of the things that I look at all the time. I'm like, yeah, we're going to need that Costco health plan that
Right.
people can go sign up for.
Well, and to your earlier point, you said that sometimes it takes like a catastrophic health event for someone to think about their health.
Right.
It it might just be that it might takes someone wanting to go work for themselves and realizing that as an individual, it's just unaffordable for them to even get health insurance and things like that. And they're like, what the
Well,
hell?
and that's a catastrophic inciting event, because if you get laid off from a
Yeah.
job, oftentimes you'll know, first of all, you'll figure out, and it's a lot more time right now. And it actually, I believe, has less to do with the economy
Mm,
than it has to do with, wow, what do we need in our new AI universe? What bodies do we really need sitting in these seats?
mhm.
And so people are going to have to adjust to that. And I think that can be an exciting event. It doesn't
Yeah.
have to be a health
Yeah.
event. It can be an
Yeah.
economic event in your life. And that's why, another reason I think why this is more important than ever.
Yeah.
Funding the patient, not the system, and people understand that. And I think those economic realities can hit home just as quickly as if somebody got diagnosed with cancer.
Mhm.
Just in a different way. I mean, obviously, getting diagnosed with cancer is a catastrophic event. It can be. Nobody wants to be diagnosed. But also, losing your job is a catastrophic event if you can't feed your family.
Mhm.
And how are you going to take care of them? Especially, what if somebody in your family has a chronic condition? What are you doing then? And those are all pieces of the pie that we have to look at. And the truth is, we all know, no matter what side of the aisle you sit on, we can't afford it.
Mhm.
We can't afford to pay for it.
It's untenable.
It's untenable. It's unsustainable. It's already unsustainable, and we're only doing half. So and that half isn't even getting the best care possible. Some are, some aren't. Depends.
I
So
I feel like I could talk to you for hours about this. But
I love, I could do I could just talk about it all day. It's one of my
yeah.
favorite things to do, because this is healthcare is having a moment, and
Hmm.
it's going to be interesting. The Democrats and the Republicans are going to talk about all their talking points. They're going to go
Yeah.
run back in their districts. They're going to do their thing, and that's great. They're going to do that. I hope they they do their thing in our favor as far as you know what we want to see. But uh, at the end of the day, they'll be sworn in on January 3rd, whatever party, whoever survives, the survivors and the new ones, they'll be sworn in on January 3rd, and the process starts all over again.
Right.
We need all new bills. We need all new stuff.
Hmm.
I mean, yeah, we have the bills written. They'll get reintroduced, et cetera.
Right.
Everything always happens. But what are we fighting for then? Because nothing's really going to happen this year.
Right. We can rely on the politicians to save us.
They're
Or
saving you. I
yeah.
say that all the time.
Yeah.
I'm like, you got to be the CEO of your healthcare. That's another
That's right.
big thing I'm pushing right now.
Yeah.
If you're not the CEO of your healthcare, no one else is coming to help you. Not the
Yeah.
government, not the hospital, not your employer,
Yeah.
not your not your representative, not your senator. Nobody's coming to help you. It's not that they don't care. They're not
Mm.
heartless people, but they're not coming to help you.
And wouldn't you want to be your own CEO
Yeah.
of healthcare?
Yeah. I think I think being in charge of your health is one of the greatest gifts you can give yourself. And we've been passive about it way too long.
I think that's an excellent point to end on. We didn't get to any disagreements, so we'll have
I'm
to have you
sorry.
back on
I
for that some other time. But
Yeah.
thanks for joining us, and I'd like to thank our audience. And till next time.
Thank you. I appreciate it, Ray.
To stay up to date, subscribe to our show from whatever podcast platform you're listening from. To support our show and the Center for Modern Health, you can make a tax-deductible donation at centerformodernhealth.org/support. Thank you for listening.